Have y'all seen this? Woo, child, this is gonna be interesting. Welcome to She Knows DNA. My name is Miavonna and I am a board certified genetic counselor. As I'm sure we are all aware, there are a number of disparities that Black people have to deal with and encounter in relation to the medical field, especially Black women. This is nothing new and has been proven through research and just personal experiences countless times. However, there are still some people out there that are literally walking around willingly with their eyes closed and their ears covered because they don't want to know the truth. But baby, it's 2025. That is unacceptable. We are going to learn together. So you already know what's about to happen. Let's get into it. There are multiple types of genetic screenings that can be done during the pregnancy, and each of them look for something different. So for this video though, we are going to focus on a screen that we like to call alpha fetoprotein screening, or AFP for short. Alpha fetoprotein, or AFP, is a protein that is produced by the baby's liver. Then it seeps out into the amniotic fluid, which is what the baby is living in. Then that crosses the placenta barrier and ends up in the mother's bloodstream. So technically, AFP screening or even diagnostic testing can be performed either through the mother's blood, so they would call that maternal serum AFP, or if an invasive procedure is done in order to diagnose a genetic condition, those levels can be tested through the amniotic fluid. The purpose of this test is to screen the baby to see if there is any present or heightened risk for there to be open neural tube defects. Whenever I say the neural tube, I am speaking essentially about the central nervous system. More specifically, these are defects that related to the brain and the spinal cord. Examples of neural tube defects are anencephaly. That is a condition to where the brain or even the head does not develop properly to the point that there is a large piece of the brain missing, if it's even there in general. Another condition that this can screen for is spina bifida. So that's when there is essentially an opening of the spine, or at the very lower end of the back. As far as how severe that can be, it just depends on what important material is on the inside of that opening or not. Another condition that this can screen for, even though it is not a neural tube defect, are things whenever the abdominal wall does not close properly. When it does not close properly, that is how you get babies that are born with their organs outside of the body. So that is things like gastroschisis and an omphalocele. So during pregnancy, this test is typically performed sometime in between 15 weeks and 22 and 6 days gestation. That is the only time that this can be performed, no earlier, no later. Now let's talk about race. There are a number of things that we do take into consideration whenever we are performing this AFP type of screening. And based off of the answer to these specific factors, it would change the parameters of the screening. So whenever we are looking at the results of an AFP screening, we are expecting the levels to be under 2.50. If for whatever reason, if I'm looking at those results and it's higher than that 2.50, that's considered positive. But if it's lower, then we're like, okay, there's a low risk for those open neural tube defects to be present in the baby. However, factors such as maternal diabetes, especially those that are on insulin, the mother's weight, if there are twins or other types of multiples, or Black race, can then move the cutoff as to what is considered positive and what's considered negative. For diabetes, especially those that are insulin dependent, instead of the cutoff being at 2.5, it'll drop to about 2.0. If you're having twins, then that cutoff increases to about 4.5. Lastly, if you are of Black race, so African descent, the cutoff is increased to about 2.8. The significance of that is that if you are not Black, then like we stated earlier, anything above 2.5 is going to be considered abnormal and cause for more detailed types of screening. But if you are Black and your levels are higher than 2.5 but lower than 2.8, you will be considered negative and therefore will not have to be referred to a different type of specialist like a maternal fetal medicine doctor. Remember, all of this is because of race. The reason why this is all a thing stems back to a number of research that's been done, especially one particular that was done in the 1980s, to where they looked at the different types of levels for AFP in pregnancies and deemed that if you are Black, you are least likely to have a baby with open neural tube defects compared to any other race. So according to their studies, by increasing that cutoff notice, then we would get way more truer types of positive for that screen compared to false positives if it was to be the same level as all of the other races at 2.5. However, recent studies had shown that there is not a clinically significant measurable difference between the AFP levels in all races. Even with us knowing that finding, they as in the labs, still have us check off what race that the patient is in. That way that number adjustment can be made. So because of this, ultimately, Black women are not being referred to a specialist like a maternal fetal medicine doctor, high-risk pregnancy doctor during their pregnancy, all because they checked off the Black note on the order, and so that cutoff was raised, in which it came back negative compared to if they were white and they did end up in that middle ground of being in between 2.5 and 2.8. Those persons would, of course, be flagged as positive, thus indicating a referral being needed. So with this knowledge, what I would suggest is if you're a Black woman and your report comes back as it being negative, however, it is still above 2.5, I would ask your doctor more clarifying questions and maybe even push for the need to have your baby have additional types of screenings like a more detailed ultrasound, just to be on the safe side. Long story short, this is example number 233 as to why there is a continuous beef between Black people in the medical field. Y'all, we gotta do better. Again, it's 2025. We have to do better. And now to leave you with words of wisdom. So one day I was at a family reunion and I saw my Aunt Mary, and she's just coming up to me screaming like, yes, that's my girl. And then she proceeds to say that she was going to break her leg. That way she could come up to the hospital and be treated by me. Now, I'm gonna let that sit in your spirit for a second because that's crazy, right? Y'all know I'm a genetic counselor, and yet I understand that people have no idea what it is I do. But I am not a doctor, nor is the clinics I would be in be the same as a clinic you would need if you, one, not only broke your leg, but if you caused your leg to break. There's a number of different clinics that you would have to go to, and not me. And mind you, during this time, I was still in school. I was still in grad school. But yet, my auntie loved me so much that she was willing to break her own leg to support me. And the reason why I'm gonna let y'all sit in that for a second, because what are you coming to the table with? Prove your love to me. Okay, you can't come at me with all this riffraff and all this and that. No, I had an auntie that said she was gonna break her leg to support me. What you got? Oh, I can hear y'all right now. Oh, that's too much. That's crazy, is it? Like I said, I'm gonna let that sit in your spirit. All right, y'all, that's all I got for today. Thank you so much for continuing to support my videos. Please feel free to like, comment, share, subscribe, all the things. Let me know if there are any topics you would like me to cover. And also, some of y'all have not been taking advantage of me offering my beautiful lecture skills in order to come speak to your people. But I'm a Christian, so I'm gonna let it slide. But just know, I am available. So I thank you all again. May God bless you and keep you, and I will see you next time.